Well, governors have been on the front lines of the fight against COVID, and many of them met virtually this week with President Biden to discuss striking the balance between state-level solutions and federal resources. Joining us now from Arkansas, Governor Asa Hutchinson, chair of the National Governors Association. Governor, welcome back to Fox News Sunday. Happy New Year to you, sir.
Thank you. Happy New Year to you as well, Trace.
Yeah, thank you. Well, on Thursday, sir, you told the people of Arkansas that your state has adopted the new CDC guidelines on what precautions someone with a positive COVID test should take or somebody exposed to COVID. I understand the goal is to minimize the disruption we have previously seen when waves of new cases cause people to have to isolate from society. But, sir, are you concerned about the confusion it has created or the criticism by some experts about the shortening of the isolation and quarantine periods and the fact that you don't have to have a negative test before getting out of isolation? What do you think?
No, I think it was an important step that CDC revised the guidelines. It's a recognition that we have to be able to manage our way through this virus. We have to get people to work. The supply shortages, the staff shortages, it really do a great deal of harm as well. And so I think they used science. They overlaid it with practicality. So I applaud them for that change. Now, I do think there is some confusion out there because you've got one set of rules for healthcare workers, you've got another one for those in the school systems, and now you've got one for the general public. I would like to see some harmonization of those because there's just a lot of information out there. We need to simplify it more for the public.
And separately, you have states that are going away from those CDC guidelines altogether. Governor, on your call with the president earlier this week, you raised your concern that the federal plan for 500 million free tests not step on state efforts to get tests to their people. And critics hammered the president for part of his response. Watch this. I'll get your response.
As you look towards federal solutions that will help alleviate the challenge, make sure that we do not let federal solutions stand in the way of state solutions.
Asa, thank you very much, Asa. Look, there is no federal solution. This gets solved at a state level.
Yeah, I mean, that created some big headlines, Governor, and the president then tweeted this response to his critics, saying, quote, "My administration has the back of every governor fighting COVID-19 in their state. Last week, I rolled out a federal plan to tackle Omicron by adding vaccination and booster capacity, hospital equipment, staff, and more. We're going to get through this by working together." Governor, what did you take the president to mean when he said no federal solution? And in general, do you believe there is a robust role for the federal government to play here?
What the federal government does well, it can use the Defense Production Act and maximize production of testing, vaccines, and they use that very successfully. It's a tool the states do not have. But what the states do well is in the distribution. We know what is needed in our state, and we have to have flexibility in that. And so whenever you look at 500 million tests that the federal government is going to procure, that's fine. But I would encourage the administration to utilize the states in distributing those 500 million tests. We can do it more efficiently. We have to have flexibility to do it. And if you don't do it that way, then you're going to be in competition because that's not an efficient way to distribute it by a website, by personal calls. And so there is a point of disagreement there, but this administration does back us up, and we need to have the flexibility, though, and I encourage, particularly in testing, give the states the flexibility to manage that distribution.
And when the president said no federal solution, what did you take that to mean?
Well, I think well, it's a little bit ironic. I mean, whenever you see the federal mandates on vaccinations, they have, in this administration, utilized federal power rather extensively, and that's one of the things we're in litigation about. So it's a little bit inconsistent. But I also take it as a good faith statement to say we've got to get through this together in partnership. We can't do it by the federal government alone. The president is absolutely right. He's relied upon the states to get the job done. I'm just saying give us a greater deal of flexibility in terms of how to manage, and don't use the federal authority to take that away from us.
Yeah, it's interesting. We look at this whole thing, Governor, and you thank the president for his efforts to depoliticize, the COVID response, adding that it was helpful. And how harmful do you think politicization has been in fighting COVID? In particular, sir, you point to the explanation that your reluctance to imposing a vaccine mandate is that you don't want to harden the resistance. So what role has pandemic politics played in all of that?
Well, too much. And of course, over the last year, people have been frustrated. We have been divided. And it really is refreshing that I believe there's a uniformity of opinion by our leaders that vaccinations are critical to get us through this. And so that unified message is absolutely essential. And we've got to, and so I complimented the president on that. Whenever you have this level of frustration in Arkansas, we need to increase our vaccination rate. We work on that every day. Every message ought to be consistent with the importance of that, and to demystify and to take away the political side of this equation, and that's how we get through it, working together.
Yeah, you engaged in a debate of sorts, Governor, with then New York City Mayor Bill de Blasio last month, where, as I said, you argued against imposing vaccine mandates, citing, among other things, hardening the resistance folks have who, have so far refused. And you've held out vaccination as an important tool in defeating COVID, just like you just said. You even embarked on a statewide tour to try to convince your constituents, short of mandates. What do you think, sir, can be done, and what do you owe this hard, fast reluctance to?
Well, there's a lack of trust in the development of it, and I think now we've got greater confidence. But whenever you had emergency use authorization, that caused some concern. But as we have greater experience, as we see the threat of Omicron, there is a greater consensus now than ever before that vaccinations are important, and so we have to continue to be consistent in it. One of the things that your previous guest, the Secretary of Education, said was that vaccinations have historically always been local and state driven. And so that is the point. At some point down the road, states can make decisions, local governments can make decisions, but it's never been at the federal government level. And that also has increased the distrust, the reservation has hardened the resistance. And so what we're in agreement is on no shutdowns. We're in agreement on the federal-state partnership, but the federal mandates on vaccinations is inconsistent with that plan.
And, Governor, while we're talking about resistance, we should note that an Arkansas judge on Wednesday struck down the state's ban on mask mandates by schools and other government entities. You praised his ruling, having said this fall that you regretted signing that ban into law back in April. You explained in an August interview, quoting, "Facts change and leaders have to adjust to the new facts." And when pressed in a recent interview about whether you would rule out vaccine mandates, you said, quoting again, sir, "I don't think with the curves that we've been given with COVID that we can rule out anything down the road." Exactly what metric are you watching specifically, Governor?
Well, first of all, in terms of the judge's ruling and the mask mandates, we don't have anything statewide. We're not doing that. But local school districts historically, and they need to be able to protect their children in the school. And so local school districts ought to be able to make those decisions, and that's what the judge's ruling said, and that's what I support. In terms of the future and the vaccine, right now, I oppose any vaccine mandate because there has to be a greater public acceptance of it, greater experience in terms of the use of it, and we don't know what is down the road. Maybe not. But whatever decision is made, it should be done at the state and local level in terms of education, in terms of what we need. Hopefully, Omicron is the end of this, that it goes through very quickly in January, and we're going to get back to normal. But we don't know what the future holds, and if it gets worse, then we've got to look at solutions that are consistent with science and what the public can accept.
Right. Yeah, and then you just read my mind, sir, because you're talking about what would change your mind. I mean, your state ranks 45th among the states in vaccination rates, with just over half, 51.2%, you see it on the screen, of the state fully vaccinated. And so hospitals in Arkansas now bracing for a wave of new patients as new cases in Arkansas have increased 310% over the past 14 days. So what is the likelihood that facts arising from this wave of new cases could might convince you to sway a little bit and back a vaccine mandate?
Well, first of all, I don't see that anytime soon. I believe that we're going to get through this Omicron. I believe that we're going to continue to increase vaccination rates. But if you look at the future, obviously, if our hospitals are overrun, if the scientific evidence continues to show the efficacy and the safety of the vaccines, and if there's greater public acceptance, then you can look at requiring it in the schools if need be. But the other thing is there always has to be the right exceptions for religious convictions if vaccines are not acceptable, and that is the current law in Arkansas, and that should continue to be the case.
Yeah, very good insight, Governor. Best of luck to you and your state. Thank you so much for coming on Fox News Sunday.
Thank you. Great to be with you, Trace.
Yeah.